AIDS Day. About 30 hours from now, Kenya will be joining the world in commemorating the World AIDS Day 2022. And right here we have the sharpest of minds to help us discuss and converse all three. And basically, let me introduce them real quick before we actually get to know what we'll be discussing today. And on my immediate left is Dr. Wamalo Andrew. He's a County Executive Committee Member for Health and Sanitation right in Bungoma County. Karibu sana. And I feel like, okay, I'll introduce everyone, then you'll officially welcome us broadly. And then we do have Caroline Kinoti, the head of the county support, the National Syndemic Diseases Control Council, that is NSDCC. And then we do have John Ndakuya, who's the technical lead at TB, HIV, USAID, Dumisha Afya, and Bungoma, Busia counties. Karibu sana. And Bishop John King Baraza Simiyu, who's the chair of Bungoma Pastors Fellowship. Karibu sana. And we do have Patrick Chelula, who's the Secretary General right in Kibabii University. Karibu sana. I feel like you should be the one telling me Karibu sana here. And we do have Basil War, who's the chairman for Maisha Youth. And I definitely have to acknowledge the presence of Dr. Caleb Wata, who's the director in charge of matters health and sanitation, Bungoma County. And right in Bungoma, right in Kibabii University, this particular hall, we do have a hall, actually hall is full of students, young people who are eager to have this conversation, matters the triple threat and matters HIV and AIDS. This particular year, the 2022 World AIDS Day, the theme is equalize, and we'll be getting to know, by the way, why equalize. So remember, you can always use the hashtag equalize and use the hashtag Sawazisha. And right here, follow our social media platforms at TV47KE. You can always chime in the conversation for your feedback and all those particular questions that you have. Waziri, I'll give you this particular opportunity to, I know I've told you Karibu, but then it's your turn to tell me, and now for all of us who are in Bungoma County, like me, for the very first time, you can tell us, Karibu, and welcome us officially right here.
Thank you.
Thank
you, Stanley. As you have been told, my name is Dr. Andrew Amalwa. I'm the County Executive Committee Member for Health and Sanitation. I want to say Bungoma has got a population of 1.8 million people who reside both in the rural and the town centers. We have 3 major municipalities, that's Bungoma County, Webuye, and Kimilili. Can you hear me?
Yeah.
Then we have 10 sub-counties. We have Kandui, we have Webuye East, Webuye West, we have Cheptais, we have Mount Elgon, we have Tongaren, we have Bumula, and then Kimilili, Kabuchai, and then Sirisia. In this county, we have 300 health facilities. We have both level 2, 3, and 4 health facilities. In terms of education, we have a number of primary schools, ECDs, secondary schools, technical institutes. We have 4. We have 2 universities. We have Kibabii University, which is a major university, and then we have Masinde Muliro University, which is a campus of Masinde Muliro. Having said that, just a quick preview of our disease burden that has brought here today. Our HIV prevalence is 2.7%. And this county is plagued by teenage pregnancies as well as issues to do with gender-based violence. So I'm sure in this hall today, we have students from Kenya Medical Training College and also from Kibabii University. I want to say Karibu Sana, feel at home. This is where we will discuss many things.
Definitely. I'm curious, but before we continue, how do you say Karibu Sana in the local language around here?
We just say Karibu.
Karibu Sana, right? Yes. And definitely no problem. See, why Bungoma County? Out of the 47 counties, why Bungoma County? And we have a few hours to Kenya joining the world in commemorating the World AIDS Day. What do we, as the curtain raiser for all this, what do we expect in all this?
Yeah, thank you very much for this. And I'm glad to be here this evening representing National Syndemic Diseases Control Council. We are here because we will be marking the International World AIDS Day on 1st December, which is on Thursday this week. This is a day that is commemorated around the world to remember the more than 2 million people who have lost their lives as a result of AIDS-related deaths, and also to remember the journey we've had since we had the first case of HIV in this country, which we had the first case of HIV in this country about 38 years ago, and I believe most of the students here, from the look of on their faces, they were not born. And until today, we still have new HIV infections every year, every day. We've made progress. Last year, we had about 34,000 new HIV infections. When I talk about new HIV infections, what I mean is that they were not infected the previous year, in the year 2020. But now they got HIV in the year 2021. And what we know about HIV is that there is no cure. So once you get HIV, then you join the cohort of persons living with HIV. So why Bungoma County? One, Bungoma County, I would say, is one of the 47 counties that we've seen an increase in the number of new HIV infections. When we look at the national data and we analyze it further, we were able to see that among the young people, and more so of all the new HIV infections, 70% of new HIV infections, Bungoma was one of the 15 counties that contributed to that. So it's one of the counties where we are focusing on. We also have a high percentage of adolescent pregnancies in Bungoma County, and also high incidences of sexual and gender-based violence in this county. And for World AIDS Day, Bungoma County has never hosted any national event, and even the larger Western region. So we thought, why not? Why not come to Bungoma? And that's why we are here. Thank you.
Why definitely not, and we'll be taking a look at later on just to understand. I mean, she was talking about some statistics and some real-time data about not only Bungoma but also other 46 counties. The data that is in there, the statistics, the number of new HIV infections, the number of the sexual gender-based violence cases. All this, we'll be taking a look at them. But then I think we'll have a video clip of one young mother who was interviewed a little today. Then we can continue. I don't know, Director, if we can have that. All right, we'll definitely have that later on. But then, right, we'll definitely have that later on. Waziri, whatever she was talking about here, what does the county done so far to help this? What will the county, do so far? Do you agree with these numbers? Do you agree with the numbers that you're hearing here?
Yeah, thank you, Stanley. Thank you, Stanley. The county has been doing, the county is doing, and the county will do a lot in terms of containing the menace of teenage pregnancies. As you know, this is not a matter of the health department alone. We need a multidisciplinary approach. First, we talk about primary prevention. Primary prevention, it means we have to talk about this primordial prevention. We have to talk about the general population, the messages that we're giving out to people. I think there's too much. So
just continue.
The messages that we're giving out to the young people, the churches, the parents at home, the teachers in schools, and then the healthcare workers. What are we doing in terms of the messages that we're giving to the young people about changing their behavior, about abstinence, about drug use? We know that this group, adolescents, are people who fall between the age of 10 to 19. These people are very vulnerable. most of them have not acquired abstract thinking, especially the people between 10 and 14. They haven't acquired abstract thinking. They can't think rationally. And therefore, these are people that should be guided in their homes, in churches, in schools, and any other grouping that we can have so that they are given the proper messages. Right. Then too, we know that the people who have acquired abstract thinking are between 15 and 19, and most of them are now sexually active. In our data, we have seen that a third of the youths between 15 and 19 have acquired their sexual debut. And therefore, it means these are people who can participate in sexual activity, and maybe they can even get pregnant. And therefore, these are the people that we are targeting to give family planning. Right. And yeah, the health facilities are already offering the family planning services, and the broad range of family planning commodities. I'm sure most youths, and some of them are here, they know P2. P2 is a common drug among the youths, but is not the first choice family planning commodity that we advocate for. This is an emergency pill that you use in the event that you have had an intercourse and you are in your safe days. And therefore, we call upon the youths, first of all, to attend the school health policy, school health programs that we have. We have public health officers and nurses going around in schools and even in colleges here to give health education to the youths. And therefore, it's up to the youth to take up these messages and be able to change their behavior, and maybe even try to advocate among the youths who are not in school so that they can also change the behavior and abstain from drug use and irrational sexual activity.
Right. Secretary John, this is definitely pertinent issues that Waziri is raising here. What is happening in the campus?
Thank you very much. In campus, life is so easy if you take it easy. In another terms, life is not easy. I don't think if you are understanding me. The issues that Waziri is talking about are real. In campus here, youths are, most of them are undergoing depressions, anxiety. Others even don't eat well. So you get that these things pushes them into many problems. Also others, because of those small challenges and problems, it pushes them to take other miles, which in turn, it returns back to affect their social life with others. Here in campus, you get that students just join, and you get someone comes from the village. He has never dated, or he has never had sex with anyone, but akifika hapa ni sherehe kuruka. You get mse like jioni, mse anaingiza beli ya kwanza. Ikifika saa 5 ya usiku, amesindikiza beli. Anarudisha beli ya pili. So hiyo ni beli ya kukuja kumwamsha mpaka asubuhi. Ikifika asubuhi, amerudisha mse anaangalia class imebounce, anarudi na beli nyingine kwa nyumba. So you get in 3 days, msa amepiga raundi karibu 15 in different people. So and we don't think here in campus, sex is a common unit. Here in campus, many of them term sex as a common unit. Many of them in quotes, but in real life, is really sex necessary? Not really. You can abstain, you can avoid. But for us as comrades, it's like food, because tumeinama sana. We decide to inama on that side.
From The comrade is right here. I'll definitely, Josh Onsare, I'm trying to locate where he is, but he'll definitely be passing around the microphone to get to hear the voices around here. But before we actually do, the Josh Onsare, there you are definitely. I don't know, we can have two voices from the comrades themselves. What are they saying?
Sure, we want to hear the voices of these young people here. And first of all, I will start with this gentleman here. You tell us your name and what is your view about this HIV and AIDS. You can start.
Good evening, comrades. I'm George Ochieng. I'm one of the senior comrades in Kibabi University, pursuing a degree in business management, accounting, finance option. In my view about AIDS in campus, it's something that most of us have taken it as something normal, something that somebody can survive. Whether you have AIDS or not, it's something common in campus. Reason being, back then, in the villages, you were being told, when you are infected, you will die. But now we have seen several people surviving with AIDS. So somebody is just saying, I can do sex row because after all, this thing has a free medicine. ARVs are free. So in any case, the government can at least give regulations on ARVs. That one at least can bring some certainty in this field. But if ARVs are continuing to be free, then I think most comrades will enjoy sex because they view they can survive with or without AIDS. Thank you.
Asante sana, tumpigie makofi. Nataka sasa tumpatie dada microphone, na kabla tufanye hivyo, kikubwa ni kwamba tuko na hashtag, tunataka kuend AIDS by 2030, sio? Mbona muitiki jamani? Tuna end AIDS by 2030. So hashtag ni end AIDS 2030. Vile vile andika pale komesha mimba za mapema. Kauli mbiu ya mwaka huu ikiwa gani? Sawazisha, sio? So tunasawazisha kuhakikisha ujumuishaji na kuhakikisha vijana hawapati maambukizi ya virusi, sio? Sawa sawa. Dada uko na microphone, ndio?
We see a particular video clip of one of the young mothers and get to hear what is actually going on there. Then we can have a response from our panelists before we actually get. I'm pretty sure there are quite a number of voices from here. I can actually see Stanley Ngara. I forgot to acknowledge him. Stanley Ngara from the King of Condoms. We'll definitely be hearing most of these voices. But right now, let's take a look at a video clip that I had promised you of a young mother. Then you can continue.
Kwa majina naitwa Sandra Dimora Elavisa na niko na 19 years old. Natoka maeneo ya Eldoret Tukulangas karibu kwa Nambaya. Na penye nimefika hapa hivi is just a journey, a very big journey. Nilijipata I was HIV positive with my first pregnancy while I was in 17 years old in Form 2. It was hard to accept myself juu nilikuwa na ball, tena ku accept the disease juu najua that disease kingia kwa mwili ni ngumu kutoka. Like pregnancy, yes, unaweza zaa mtoto and mtoto anakuwa mkubwa, but the disease ni ngumu kutoka. Ikakuwa ngumu kuji accept. Since that time when I was in 17 years I started nikaanza kumeza hiyo dawa mpaka penye nimefika now is 2 years down the line nikitumia that medicine, but niko healthy na namshukuru Mungu. Before niko HIV positive, I was in a relationship. Kwa in that relationship, so that's why nikaenda to have sex with the boy. To have sex for the first time. For the second time, ndo nikapata ball. The man left me with the ball and the disease. But my kid is good. Nikajifungua mtoto kwa salama na she is negative. Mpaka penye nimefika hapa hivi. Nilikuja kugundua niko na maradhi yake wakati nilienda hospitali kupima. Nilienda nikapima nikapatwa niko na ujauzito. Na lazima upimwe hali yako ya mwili na other STIs infections. Ndio wakanipima hapo hivyo nikapata na pia niko na virusi vya ukimwi.
Na pengine wakati ambapo ulipimwa ukaambiwa kwamba uko HIV positive, hatua gani ulichukua? Pengine uliwaambia wazazi wako, na ulichukua hatua gani baada ya hapo?
Kuchukua hatua, nilikuwa na mzazi hospitalini.
All right, then they will definitely have it. Ndakuya, as someone who deals with the USAID in Bungoma and Busia counties, are this voices that you hear mostly? Are this what's happening? The whole programmative field that you work in.
Okay, thank you. These issues are very happening amongst ourselves and also very common to youths. So we've just heard of the youth just narrating on what is happening and what happened to her that led to her having HIV. So as a program, we are major implementing partner Matters HIV and also TB. So what we are doing is that we are just looking at the three threats that the country is facing. And number one is early pregnancies. So what happens is this, that you realize that most youths are not even having fear contracting HIV, but they are fearing getting pregnant. So that's something that's really amazing, and it's something that we really need to take into account to make sure that these teenage pregnancies are alleviated. But now you see, if you are not fearing HIV and you're getting pregnant, that means you had sex without a condom or without protection. So what happens, and one, they get a partner whom the first time they'll be able to use a condom, the second time they'll use a condom, then the third time they're saying that tumezoeana. So they put aside a condom, and this time whereby this youth will be able to get pregnancy. And the pregnancy also is accompanied by HIV/AIDS. That's why we really advocate that they need to stay until the time when they are ready for marriage, or until that time whereby they are mature enough for marriage, then they are able to get pregnancy. So that's one thing that we are really advocating to the community to make sure that we alleviate this issue of early pregnancies. So number two, we are looking towards issues reducing new infections in the country. And to be specific, that is Bungoma and Busia counties, whereby we are advocating giving information to the youths, giving information to the populations, cutting across all ages. So what happened is this, that we move across the counties, whereby we have healthcare workers whom we are supporting through the county, offering services. And one of the things that we are doing, we are giving medication to those ones who are HIV affected, just to make sure that they live a well life that does not have, like maybe having concomitant infections. Then number two, we are making sure that as prevention, there are things that we are doing, like we are giving PrEP, that is prevention, pre-exposure prophylaxis, just to prevent someone from getting HIV. And what happens is this, that if you are at a high risk of getting HIV, or you are ongoing risk of getting HIV, we'll be able to give you PrEP just to make sure that you take this medication that can prevent you from getting HIV. Then we also have PEP. PEP that is given to someone is called post-exposure prophylaxis, given to someone who has been exposed to HIV by virtue of having unprotected sex. And number two, by virtue of just engaging in sex unknowingly or under influence of drugs, or just having unwanted sexual behaviors that may lead you to having HIV. So we give you post-exposure prophylaxis.
Sure, there's a number of questions from the audience about that. But before we actually continue, I want to engage Dr. Wata, who's on the first row right here, just relaxing, listening to us very, very keenly. Dr. Wata, the implications of this, basically the whole, the triple threat, what are the implications from your experience? What are the implications of all this?
I'm Dr. Wata Caleb. I'm the County Director of Health, Bungoma County. Maybe I would want to give it an approach whereby I would want to simplify, because it's a long story if I start talking about it. But basically, at our facility or as a medic, these are cases we meet on a day-to-day, whatever that we handle in our places. And what happened is, the first approach is that whenever we meet a case of teen pregnancy, you know, it's so easy for you to get pregnant, but handling that pregnancy to term is very difficult on the side of the mother. And basically around the sex, the intercourse, what normally happens, you know, some of us men, we do that sex in a rough way so that we cause ruptures and tears of the genitals. I know you understand what I'm saying from the boys. So basically there are complications that arises around there. And also we have complications that arises during the pregnancy itself. Like carrying that pregnancy to term is so difficult because at the end of the day, they go through a lot, like especially during the first trimester. These mothers, they undergo what we call hyperemesis gravidarum, whereby they vomit a lot and they lose a lot of fluid. And basically during the pregnancy, they can as well lose the pregnancy, and it has also complications that may give rise to infections that also need to be controlled. And during the intercourse itself, that is the time they can be able to get HIV/AIDS. And basically, they have to be put on medication, and that is a big burden on their side. Thank you.
Bishop, are these conversations, and when we talk about, it is the religion, a key stakeholder in our society, are these conversations held in the churches, in all religious holdings and places? Are these conversations really in the church?
Bwana Yesu asifiwe. I want to appreciate and thank God for such a time as Bungoma County to host the National World AIDS Day on 1st December. HIV/AIDS in the church, it is there. But we have a big gap between the religious leaders in our institutions, because sometimes we tend to feel like it's a taboo to speak about sex in the church. And the teenagers we are speaking about today are the same people who come to our churches. And because some of us religious leaders leading churches, we are not able to have the information. We lack the information about the spread, which we can be able to share with even the teenagers we are leading. And sexual education in the church among religious institutions is lacking. And that's why you find that they try to go out to seek information. Now we have the peer influence.
What's the response like when such conversations start in the church? Response like?
Like in the church, most of the churches today, I as a Bungoma Pastors Fellowship Chair, we have a program that we can train first our leaders to have information about HIV/AIDS, the spread, the infection, and its effects. When a religious leader is aware of this prevalence of HIV/AIDS, then once he's empowered, we are trying to ask them now to get time to reach out to teenagers, people below 21 years in their churches.
Right. War, I want to come into this. As an NGO working with the youth in Bungoma County, what are the challenges that what basically do you hear from the ground? The waziri is here, stakeholders in the government might be saying this, but kuna zile vitu ziko kwa ground. Now, maybe vitu ziko kwa ground ni tofauti, but what are the challenges in the ground really? A word.
Thank you so much. The challenges on the ground, we've been having drug and substance abuse. We've also had ignorance, misinformation, and also inadequate resources. Yeah, thank you.
Yoashun Sare, uko salama?
Niko salama, nashukuru.
Sijui watu wanasemaje hapo ndani.
Naona tunaendelea vizuri. Sasa tupate maswali na vile kusikia hao vijana wanasema vipi. Dada, uko na mikrofoni hapo, ningeomba upatie mmoja hapo. Naweza uliza swali. Uanze na jina lako alafu swali lako.
My name is Travin, member taking English and Literature in my third year course. And my question is this. I've watched news, and one of the bulletin was that there is shortage of copulatory tools in Bungoma County. I pass my question to the stakeholders from the county. what are the strategies that they have put to counter this? Because previously, I think in like 2 weeks ago, there was some news that in Busia County, the sex workers are recycling the copulatory tools. But right now, we are here talking that we are fighting HIV and AIDS. So I'm asking the county executives, what are the strategies that you've put across, that you've put in place to counter this? Because on the sides of comrades, the only way that we use to fight AIDS is using the CDs. But sasa we are told there is a decrease. Sasa tutafanya aje? Because as you know, we cannot say that you are going to rule out population among comrades. But sasa, what have you put across to fight that? Thank you.
Hilo ni swali la Dr. Wamalwa, tutakuwa unatujibu. Na vile vile swali. Okay, kuna dada hapa, tuambie jina lako na utuulize swali lako.
Okay, Kimberly Kisia from Bungoma KMTC. My question is, as a country, do you think that it will be better for us to lower the age at which we can offer sex education and family planning methods to the rest of the population? Because as at now, it's illegal to give family planning to a person under the age of 18. And as we can see, there are teenage pregnancies, there are children who are who are sexually active and who as at the moment have teen pregnancies. So I think, okay, I was just asking, is it possible for the country to lower the age at which we can offer family planning to these methods? I'm carrying out a research on teenage pregnancies currently, and my youngest respondent is 12 years. So I think saying that it's illegal to give family planning to a person who is under the age of 18 should be something that the government should consider changing.
Asante sana. Mwingine?
Okay, I'm called Samuel Wanjala, a student from Kibabe University. I've heard about the hashtag Tumalize 2030 Ukimwi. Okay, the hashtag 2030 we end the AIDS. So are you going to kill these people with HIV or what are you going to do? That is first question. Second question, how are you going to ensure that your hashtag comes true? Because currently young children are engaging in sex even 12 years. A child knows how to do sex. So how are you going to ensure that actually your hashtag is true?
Thank you very much. I think this question will be answered well by the CEO and SDCC. Swali lingine, kuna lile pale, ndio.
Thank you. My name is Kugu Domian, a second year student. I have here a question with me directing to the CS Education. This university is giving us this type of CD. So I wanted to inquire between this one and the other one that was issued, the red one, which one is more preferable?
Tutakuwa tunapata. I think there is one here, last one. Kidogo tu.
Good evening. I'm Jackie Esther, a third year student taking Bachelor of Criminology. There is this hashtag End AIDS. And in university, we have this problem of long chain relationship or malisafiende chain. Yeah, it is a problem in university. How can this aid end by 2030 na kuna hiyo shida kwa university? Thank you.
Asante sana. La mwisho hapa.
My name is Stella Wamalwa. I'm a first year in Kibabi University. Mine is just a suggestion, or I don't know, it's an idea, because you are saying you want to end HIV and AIDS in 2030. Maybe because you say when you take those medicines in 72 hours, someone will not get infected. What if you give those medicines to everyone, and after and after they engage in those sexual intact, they take the medicine? I think if they are infected, those diseases will disappear. And then before we get to Vision 2030, the people with HIV/AIDS will have reduced because most of them will have died. And
Sawa sawa, nataka mtu aulize swali kwa Kiswahili na arifiwa kwamba yes.
Question, but then the question on the whole condom, the type, I'll let Stanley Ngara, who's the king of condoms, to answer that real quick before we continue with the panelists.
The microphone.
Stanley.
Stanley, ngoja kidogo.
One thing, thank you very much once again. One thing I want to say is condom is condom. We have just names and packing differently. And in Kenya, we are the only African country that is giving free dotted condom. So we have dotted condom, we have flavored condom, they have just added for value. By the way, the most expensive condom is 6,000 that we have ever seen. So the purpose of condom is to protect HIV, pregnancy, and STIs. So that is the most important thing to know. But the package and the presentation might be very different. And thank you very much.
Stanley Ngara, the king of condoms. And I'm pretty sure that actually the whole matter of the condoms and all that, it has opened a whole window of so many other questions. And I'm pretty sure people are actually curious. Is it started ni gani zenye naongelelea? Is it ni gani zenye naongelelea? But definitely, I mean, this is the first day. So there is tomorrow. There is again Thursday, which is the first day of December, the 2022 World AIDS Day. So for all those questions that you have, keep them locked. We'll definitely have the panelists right here. We'll definitely ask them all these particular questions. Felix Waziri, we can start with you on the whole matters. There's the whole shortage of condoms in Bungoma County. Again, we could definitely talk about that, and also a response by Kinoti.
Okay. Thank you so much, Stanley. Condom shortage. As a government, we try to distribute condoms to reach everyone. But that's not enough. Because what you had the university students say, the people are overactive than others. Maybe they consume more than others. So when the rest are, they want the service, they find that there's no condom. But nonetheless, dual protection is a personal issue. It's not a government issue. Government will try to provide condoms. But as an individual, ensure that you can get a piece of condom. If you can't get the one from government, at least Kenya is a liberal society. Every pharmacy, every chemist stocks a condom. At least you can go there and buy your piece so that you are safe at any given time. Don't wait for emergency. You have an admission today to get a condom. Always have your stock ready for that.
Basically invest in condoms.
Yes. As students.
Right, Kinoti, okay, fine.
About lowering the age for sex education and family planning, remember that we are all protected by the Constitution of Kenya 2010. And Article 43 of the Constitution says every Kenyan has a right to the highest attainable standards of healthcare, including information to reproductive health services and even the service itself. So our constitution is non-discriminatory about who should get health information, especially about family planning. So I'm sure it's an emotive debate about availing the service of family planning. Some people say they are mature minors, others say they are underage, but the cornerstone is, and this to parents and this to university students, if you know you are sexually active, for sure you have attained the sexual. Remember, abstinence is a method of family planning. The implants, abstinence is a method of family planning. So if you can't abstain, use protection.
Right, I'm definitely hearing a lot of mamas when you mentioned abstain, and they're wondering, abstain. But Kinoti, I'm still answering what from the audience, the whole issue of condom shortage now, as someone who works in the government, basically.
And thank you for bringing that up. And it's true, we've had shortage of condoms. From donors. Continue, and that's why we are saying if you need condoms and you don't have access to the free ones, you can buy from any chemist or any supermarket or any shop that is buying them. And I will also tie this to the issue of ARVs. Somebody said that ARVs are free. So even if you get HIV, you will get ARVs and you will lead your normal life. What I did not tell you is that with the 34,000 new HIV infections we had last year, we also had 22,000 people who died as a result of AIDS. So people are still dying as a result of AIDS. Yes? And we are getting ARVs, most of them from donors. What we have seen over the last 5 years or so is that donors are also cutting on resources for ARVs. Whatever we were getting, they are reducing that. And government is now being forced to put in more money. We don't know up to when. And you know, when you are getting something from a donor for free, maybe after 5 or so years, they may say, we can't support this anymore, you take it up. It's your problem, it's your burden as a country. Now, if you are on ARVs, the donor is not providing ARVs, the government is not procuring ARVs because there is drought. They need to buy food. Now you are forced to go into your pocket to buy ARVs. Maybe we are getting to that point. That's why we are here today talking about prevention. I understand sex is a common unit here, but ensure you have safe sex as an individual. It's a choice you will have to make. And it's for you to know what happens actually if I get HIV. I may look okay 1 year, 2 years down the line. What now if I get AIDS? I will die. And we have seen most of the people who are dying as a result of AIDS are children and young people. Most of the older generation who have been on ARVs also for long are getting what we call non-communicable diseases as a result. They are getting cancers. So ARVs, popping the ARV is not the magic to ensure you have a normal life. There are also implications, and there are also other complications and side effects that come with that. So briefly also I can talk about the issue of family planning and giving family planning to young girls, even as young as 12. In this country we have policies that guide us, and I know CC has talked about the Constitution, which also defines who a child is. And a child, somebody who is below 18 years, is not assumed to give consent. So as a health provider, if a child or somebody below 18 years comes and you give them maybe family planning and then something happens to them, you know now the legal jargon and explaining why you did that. Yes, yet the Constitution defines who a child is and that they cannot give consent. But the issue of providing sexual education, it should start as early as possible. You don't have to call it to a 6-year-old that and you go full blast and say sex education. Start by teaching them, you know, about their private parts, what they should do, how they should protect themselves. Yes, if somebody comes, wants to maybe asks them to remove their pants, you know, or touch their private parts, they should say no and report. That's how you start health education, depending on the age of the child. As you progress, as they understand more, then you can them about sex education. Thank you.
Right, and we'll definitely be getting deeply into the whole sex education, and I'll be getting with the Bishop on how all this is done. But then, Kinoti, when an issue was raised on the whole hashtag 2030, and you know, I mean, it's 8 years to 2030. Are we too optimistic about 2030? What so far? Is it so far so good, or time will tell?
Yes, hashtag end AIDS by 2030.
Yeah.
And what that means is that we hope by 2030 we don't want to have Kenyans or citizens dying as a result of AIDS-related deaths. There are those who have HIV. They can lead a normal life if they take care of themselves, if they are on medication, but they don't have AIDS. So it's about ensuring that by the year 2030, we don't have any individuals dying as a result of AIDS. You're asking whether we are headed towards addressing that. It depends on how we adhere, first of all, to the policies that we put in place. But what I can tell you now is that we have, with the increase in the number of people getting HIV, and also the slight increase we've seen in the number of people dying as a result of AIDS, if we don't change our strategies, then we will not be able to achieve that. Thank you.
Right. And definitely, I'm pretty sure that we might say that we're on the right trajectory, having such kind of conversations right here with such an audience, live on national television, having such discussions. We are on the right trajectory. Bishop, talk about the sex education in the church. How is it done?
Allow me to read a scripture in the book of Hosea 4:6. It says, "My people are destroyed for lack of knowledge. Because they have hidden knowledge, so they'll be destroyed." And that's why this evening, when the church lacks sexual education, that is where most of our teenagers engage in premarital sex. And as a church, as a leader in this county, I would like to urge and propose that we, as the ministers of the gospel, it's good that we reintroduce sexual education in our preachings and special gatherings, especially among the youths. Just yesterday, I had an interview with a young man who is a worshiper in the church, one of the churches, who has just been confirmed positive the other day, and is only 24 years, and is married to a young lady 20 years old, both are in the church. So you find that this young man is just being surprised because his leader has never taught how he could have walked in his life as a youth. The church, my proposal has been, as a leader, that we can come with a curriculum, Bible fitting, that we engage our young people in the church so that they can have a know-how and the reality of life. Because today, society we are living in is changing. Things are not the same the way they were some 20 years ago. These young people in the church are socially active, and when they meet together alone, they engage in sex. When they come to church, they are be a hold and thou. We feel like they're worshiping God, but at the end of it, they're engaging in sex. In fact, that's why most of the teenage pregnancies are in the churches today.
Secretary, he talks about engaging the youth more on this. Are the youth engaged more? Is there inclusion in such conversations among the youth?
Thank you. Youths are engaged in that conversation. It's true they're engaged, but most of them, they don't like that conversation. It's true that if you start that conversation with some, they will turn their backs on you. And most of them, they don't like being told the truth. Because if you tell someone what you are doing here is wrong, if you tell someone this thing that you are doing, bringing different ladies and doing this and this, telling me that kufa dereva, kufa abiria, it's bad. They, yeah. So when someone don't use condom, he tells you that, mimi ni kufa dereva, kufa abiria. So you ask yourself, what's this? So because that, and when you try to bring that conversation or that topic, he will not listen. But it's true that the public, the church, and everyone engages the youth in that conversation.
Now, from your perspective as Maisha Youth and everyone who is involved in that, how best can we do that? Engage the youth, because I'm pretty sure we definitely have this conversation here, and they listen to you as leader, they listen to they listen to the church. But then, how best do you tap into the attention, and they can actually listen to you, as the youth, basically?
Again, my name is Basil Owor. I'm the chairperson for Maisha Youth, Bungoma County. Maisha Youth is a movement that informs, empower the young people to make informed decisions. So a way to involve the young youth, we have various, but I'll talk about the main that is not always spoke about. You see, our fathers were proud of mashamba. You see, our fathers used to invest in mashamba. Oh, nimebai shamba pale, nini, nini. So as youth, I think my youth will invest on social media. So how many youths are getting paid on TikTok? Thank you, thank you, thank you. So I think the best way... okay, I understand. So I think the best way is create this sensitization mainly to become on social media, where so many youths can be reached out. Thank you.
Ziri, I'll get back to you. And there are quite a number of interesting ideas here. But let's say, talking about Bungoma County, any special programs, to actually talk about this? Any special programs to help even Maisha, youth to actually thrive in such kind of discussions?
Yeah, thank you, Stanley. The school health policy has been with us for quite some time. And Bungoma County is not left behind in the implementation of such policies. We have teams in every sub-county that go around in schools to give education to children of all ages. In the policy is well stipulated what age should be given what kind of information. And that's done all from lower primary, upper primary, secondary schools, and even universities. So our youth should not say we are not intervening. And even we have public health officers and nurses that work in the community that go to churches and they ask for permission from the clergy to address the congregations and give health messages. When the church organizes events for the youth during the holidays, again, our teams go there to sensitize the youth about sexual education. So for us as Bungoma, we are trying all that we can. We also have youth-friendly services. Like in Bungoma County Referral Hospital, when you come there, there's a youth-friendly corner that you come there and talk to your nurse or your doctor, and you're able to interact at a personal level. We are telling our healthcare workers, as much as you can be advanced in age, when handling the youth, try to be young at heart. Come to their level, discuss with them, talk in a language that they can understand better, so that they're able to share with you their concerns, their hesitations, and therefore they can be able to take in the information that you are giving them. Secondly, we understand that youths work best in groups. The age between 10 and 24, they work best in groups. They tend to hear and emulate what their peers do and say more than what the adults advise them to do. Okay. And therefore, we are in the process of coming up with promoters of sexual education, like what now I've known my friend Basil Odwor. This is the kind of people we want. Youths advocating for youths, because they will be heard more than me speaking to them. Nevertheless, I'm not so old, but I believe I'm young at heart. Still, I can champion for the messages for the youths so that they can change their behavior. And most importantly, parents. Our colleges here in town, this Kibabi University and Kenya Medical Training College, even that the students who come there, there's no fixed hostels that accommodate the students. Most of them live in the community where everything happens. So we are also talking to the schools, the university, if they can able to provide accommodation to these students so that they can be contained in one area so that it's easy to reach them. But when they are scattered all over the community, they become vulnerable because they interact with the community and we don't know what happens there.
Ndakui, as under you said, how does USAID and trying to get to the grassroots, how does it incorporate the triple threat issues in your programming for sustainability? Because as you know, the whole hashtag by 2030, we'll definitely be having this conversation this time, and then next year, 2023, first day of December, we'll again have this conversation. But then for sustainability, how do we to involve and incorporate the triple threat issues?
Okay, thank you, Stanley, for that. I remember I alluded earlier on when I began my speech or the interview. I said that as a program, we are supporting the county just to realize these indicators or achieve these threats that are affecting our country or our county. So one thing, pastors say that people are perishing because of lack of knowledge. So the first thing to address an issue is to make sure that you have information. So as a program, what we are doing is to make sure that each and every individual in the country and in the county is able to know this for HIV status.
Right, sorry for that.
Okay. So how will you be able to know your HIV status? Is by going to a health facility and being tested for HIV. Two, Waziri said that even the HIV test kits are available in the chemists, which are called self-test kits. So what we are doing is advocating for knowledge and information. So we understand us as partners, we have some timelines that we will be able to operate in the country or even in the county. And at that time when that time elapses or the funding elapses, will not be able to be around to offer these services. So what we want is that empower knowledge and everyone to take care of his life and make sure that once you know you are taking care of your life, inform others. So it should be a network of just making sure that the information is passed from generation to generation and making sure that each one of us has the knowledge. Then another thing that we are training healthcare workers in these facilities in the county just to impact them with knowledge about HIV management, HIV prevention, just to make sure that they're able to manage the patients when they come to the facility. And
what are the biggest, sorry to cut you short, what are the biggest challenges when you're interacting with the healthcare workers deep in the grassroots levels? What are the challenges that you hear from them? Before I get the last words.
Okay. The challenges that we encounter, number one is attitude. I know attitude is very difficult to change. Someone accepting that I need to offer services to a HIV positive client. We call the HIV positive patients clients because they come to the hospital even at some point when they are having no illness. So attitude is a big challenge. Number two is also the other issue of staffing levels in the facilities that you may find. The lowest level facilities you find that we are having like one healthcare provider. But I'm happy that the county is really doing much by employing staffs just to help that these services are being provided. Then at some point, I know it has been alluded about the tools that we use, like for example, the testing kits. But I know the government is procuring that, and also the condoms that we give to the clients coming to the facilities has been a challenge. But we are having the Kenya Medicine Supplies Agents that is coming in just to make sure that these medicines and condoms are available that can be provided to the patients. But the last thing that is a challenge is the patient accepting that I'm HIV positive. So if someone has not accepted that I'm HIV positive, it's very difficult for you to offer the services. Because you'll give the medication, the patient will not take the medication. So you'll be doing a waste. So what we need to address is that people accept that they're HIV positive and they know that they can be able to prevent HIV spread to other populations. Yes.
I'll get to you, War. All right, I think I can get one or two questions with Sarah. Hey, there are quite a number of them, but we definitely can't have all of this. We definitely can't. We'll definitely. I think we can have a gender balance. Take a gentleman and a lady, and then we have the answers. Then our last words. Then we call it a day. How about that? I'm sorry.
Sawa Stanley, tuanze pale. Dada, unaweza peana microphone to one of them, then we'll get one from here. Iko sawa? Bado? Have this one?
Okay, thank you. My name is Nicholas Momanyi. I'm a second year taking Bachelor's of Social Work at Kibabii University. Okay, mimi swali langu nauliza ni moja. Nikiwa huko nyumbani bado, hospitali zenye tulikuwa tunaendanga bado, hii mipira haikuwa. Tumefika hapa Bungoma na bado imekosa. Swali langu ni huu ufisadi ambao bado unaendelea kuendelea Kenya. Bado humo katika hii mipira ambayo tunatumia, kwa sababu kama serikali yetu iwezi manage kupata hii mipira, it means that haijachipanga bado. Na sisi kama wanafunzi sahi, kama kuna kitu ambacho uwezi kukataza comrade ni kwamba ku have that okay, tunasemanga kwamba upenda at least upunguza yale mawazo na kuwa nayo kutoka nyumbani, kwa sababu unaweza maliza wiki moja kama mzazi haja kupigia simu. Kwa hivyo ukipata mtu mzuri ya kupigia simu kila wakati, that's your comfort, hapo ndo comfort yako iko. Alafu kitu kingine, most of our comrades here watu tunainama bana. So wezi niambia utakataza msichana kuinama, alafu kisha baadaye ameenda uko kandu amepata shilingi yake 500, alafu kesho unamwambia kwamba achana na hizo vitu. Kwa hivyo yani nile tuseme wazazi wetu na at least serikali yetu ijaribu kuangalia sana wale wanafunzi ambao tuko katika chuo kikuu. Alafu kitu kingine, mimi mwenyewe binafsi siwezi tembea na bagi yangu kama haina CD ndani, haina condom ndani. Mimi kama SIGNET nafanyanga kazi ya kutembeza hizo vitu. Nikiwapata mko wawili na wapatia. Hata sasa siwezi koza, ndio hizi niko nazo hapa. Sasa mkiniambia zimekoza, it means mmeharibu kazi yangu. Mimi am a social worker. Zikikosa au watu wengine wataishi aje? As a social worker, I have to care for the other people. Na hivyo zikikosa, serikali yetu ijipange. Kwa sababu pastor amesema kwamba kitu ambacho kimeua watu wengi ni kwamba ule ukosefu wa elimu ama kimasomo kidogo hivi. Kwa hivyo it means serikali yetu nayo haina hiyo elimu na haina kimasomo kidogo. Kwa sababu kama iwezi kuleta hivi vitu ambavyo pei yake ni ndogo. Donors sasa wafawidhi wamekataa. Tutaishiaje sasa? Sisi ambao tuko hapa katika campus tutaishiaje?
Nasema tupatie binti, sio? So that we can balance the gender.
Both. Thank you. My name is Damaris Juma. I'm the national team lead for Maisha Youth Movement. My question goes to the county government. We understand we are from the political season and it really affected the data, especially in Bungoma, teenage pregnancy and gender-based violence and also new HIV infection. Same to COVID-19 and climate action is really a pandemic affecting us right now. You can look at during COVID-19, there are a lot of cases for the triple threat, which we are walking into another pandemic of climate injustice. What do you think as a county we can start doing so to prevent what happened during COVID-19? Thank you.
Tumpe wa mwisho, sio?
Thank you. My name is Sylvia Songa, faculty BCom. I have no question, but I have a concern. There is something you people are not talking about. It is obvious that all of us are not HIV negative. We also have the positive ones. And the truth is, you cannot use condom for entire of your life. I'm a VP comrades. See, a lot of you have that slogan of nyama kwa nyama. Yeah. So what I can ask the government, our CEC Health and others, is that we should make it easy for youth to get that PrEP, pre-exposure, not PEP. PEP, that one, it cannot help easily. PrEP is the best. Yeah.
I've finished them. I'm pretty sure you've noted them down. I can start with you, Waziri. Because of time, again, we'll definitely, real quick, then we can have the last words. Waziri.
Yeah. Thank you so much, Stanley, again. The issue of condom shortages, that's what he raised there. I think we addressed it. Yeah. The government will try through partners and other sources to avail condoms. And also, at individual level, you can also try. When the condoms come, pick and keep your stock. Yes. Don't wait for emergencies to catch up with you. About climate change, this is a question from Damaris. Environmental degradation is as a result of population growth. One of the things we are saying, and it has been said all the time, check on fertility. And this is about family planning. Get the number of children you're able to take care of. 2, check on the environment. Don't litter. You know that the government has put in policies to eradicate polythene bags. Please, let's not perpetrate the same vice. Deforestation is a result of human activities. Please, let's not invade our forests.
Real quick, Waziri, you can look at that camera, your last words, even as I get the answers and the response and the last words. You can look at that camera right there and your clarion call and, to the youth, to everyone, all the stakeholders involved in all this.
Thank you again, Stanley. We understand that utilization of healthcare services among the youth is very low. And my call to the youth is, those are people between 10 to 30 to 34. Kindly, let's embrace the culture of going to healthcare facilities. The trained healthcare workers are there for you. We not only give injections in the facilities, but also health messages. We have a platform to interact with the youth and people of all ages. Kindly come to the facilities, embrace healthcare workers, let's work together, and we are going to reduce this menace of HIV, AIDS, and also teenage pregnancies. And for those who get teenage pregnancies, don't shy away. Don't stay in the house. Don't walk to the traditional birth attendants. Don't walk to herbalists. Come to a healthcare provider, talk to that person. We have policies in place. They will guide you. They will protect your life for future fertility. Thank you so much.
Thank you, Waziri. Kinoti, your response, and obviously your last word. You can look at them, the audience, straight in the eye as you, your clarion call basically to them, the triple threat, ways to actually, curb all this and end it basically.
Yes, so my last words about this is one, take care of yourself. It's an individual responsibility. You can either abstain or you be faithful to your partner, who hopefully is also faithful to only you. Or if you can't, use a condom and use it correctly. But I'll also say this, in case you are raped, defiled, there are date rapes that happen, or you find that you've engaged in unprotected sex. That's not the end of it. Visit a health facility, get PEP, so that you don't get HIV, and you can get even counseling and all other services that are provided. There is also PrEP, which is available in the health facilities. There's somebody who asked about that. You can access PrEP in any of the health facilities at no cost. And for those who are also HIV positive, take your drugs, take your medications as advised. Take care of yourself and your nutrition so that your virus levels is low. And that way, then you are not able to transfer the infection.
Right, because I'm out of time, we definitely have to continue this conversation. I'm pretty sure you are here tomorrow and again on Thursday, so we'll definitely be getting more from the rest of the gentlemen. Thank you very much, Dr. Omalwa Andrew, the County Executive Committee on Matters Health and Sanitation right here in Bungoma County, and Caroline Kinoti, who's the head of County Support, the National Syndemic Diseases Control Council, that is NSDCC, and we are obviously joined by Dr. Caleb Wata, who is among the audience right here. He's the director in charge of Matters Health and Sanitation right here in Bungoma Matters County. And then we did have John Ndakuya, who's the technical lead, Matters TB, HIV, USAID, Dumisha Afya, Bungoma and Busia counties. And Bishop John Kinbaraza Sibiu, who's the chair Bungoma Pastors Fellowship, and then the Secretary General Ndio Mkubwa watu hapa, the students, the comrades basically, Patrick Chelule, Secretary General Kibabii University, and finally Basile War, who's the chairman of Maisha Youth. Ladies, gentlemen, thank you for your time. It is much appreciated having this particular important conversations, basically. And thank you for your audience. I think we can have 2 claps for all of you who asked questions and who did not want to. Thank you very much. My name is Stanley Nyaringita. On behalf of everyone, including Josh and Sare, asante sana for tuning in. This is TV 47. Abubakar Abdullah is on the other side for the news.